I'm a general surgeon and I practice in the Quad City area. My office is located in Davenport, Iowa. I grew up in the community and I returned here after my training with the intention that I wanted to help my friends, my family, and the community. My specialty is advanced laparoscopic and robotic surgeries, but recently I've come across a new venture using minimally invasive techniques to treat a condition called venous insufficiency. A lot of people don't understand what that is and maybe have never heard of that, and so my goal is to educate the community on what that means. Venous insufficiency is the failure of valves within the veins to work properly. Why are there valves within your veins? Well, the way the circulatory system works is the heart actively pumps blood out through the arteries and into the tissues where oxygen and nutrients are exchanged. As it pushes it through the tissues, it has to return to the heart through the veins. But because we're mostly standing or sitting, it has to go uphill for the majority of the time. There are valves within these veins that act like rungs on a ladder so that with each pump of the heart, the blood goes higher and higher to the next level until it reaches the heart again and it starts the circulatory system over. Over time, however, gravity wins out and these valves will start to fail and allow blood to flow backwards in the wrong direction back towards the feet and ankle area, which will cause swelling in the tissues initially, which may result in multiple symptoms such as heaviness, fatigue, pain, aching, burning, cramping, restless legs. There are multiple symptoms. Itching and burning are included in those. While there are many reasons why these symptoms can occur, venous insufficiency is one of the most prominent reasons that most people don't really understand or know about. The other thing that can happen is with this backwards pressure going in the wrong direction, there's also a backflow into the tributary veins flowing into the deeper system, which will ultimately bulge and get larger and stretched out. This is where the varicose veins and spider veins are developed. Some of the most obvious signs include the veins that you can see on the outside of your leg. They may appear to be wispy, cobwebby looking veins, these are called spider veins, or it may appear to be a large engorged vein that is just under the skin, and these are called varicose veins. What makes a person at risk for developing these venous insufficiency and varicose veins? Well, number one is a genetic predisposition. So if your parents or grandparents suffered from venous insufficiency and had varicose veins, there's a good chance that you're going to develop that as well. The second thing that puts us at high risk of developing venous insufficiency includes career choices. So if you're in a profession that requires you to stand or sit, being very sedentary for long hours of time during the day, you're at very high risk of developing this problem. Some of these career choices may include secretary, nurse, hairdresser, barber, factory line worker, or any other career choice that makes you stand for long periods of time without much movement. If you feel that you're at risk for development of venous insufficiency, then you should call my office and we can bring you in, do an evaluation, talk and discuss your condition and your risk factors, and just go from there and figure out whether you're at high risk or not. Ultimately, an ultrasound can be performed to definitively diagnose what kind of condition your veins are in. Give my office a call and I'd love to sit down and help educate you more and resolve any question or concern that you may have regarding venous insufficiency. This is no different than having a chronic disease such as high blood pressure or diabetes. It's an ongoing process, so it never gets better. It will continue to progressively worsen. So while it may not appear that you have signs or symptoms of venous insufficiency, this is such an ongoing slow process that most people develop signs and symptoms that they don't even realize. They just assume that it's normal to become more tired and for your legs to become heavy as they get older. Ultimately, down the road, as this disease progresses, if it's failed to be treated, it can lead to very unsightly veins on your legs, number one. Eventually, this will develop into discoloration of the legs as blood begins to become trapped under the skin. And as your body breaks it down, it releases a chemical called hemosiderin, which is the iron in the hemoglobin. And this causes a staining no different than a tattooing on your skin. And if it comes to that point, most of the time, even after treatment, this may not fade away. It will become a permanent discoloration. The worst case scenario, if left untreated, would become the development of wounds on the lower part of your leg that become very challenging to treat, because if venous insufficiency continues, it causes enough pressure that it does not even allow the good arterial blood to get to the outermost layers of the skin, so that healing is almost impossible. These patients that have chronic wounds will be treated for months in a wound care center, failing to get adequate treatment because the wrong problem is being addressed. Once their venous insufficiency is resolved, oftentimes their wounds will heal within a matter of weeks and not return as long as their venous insufficiency stays in check. Once I sit down with you and I do an examination of your legs, ask you a few questions, I can come to a pretty close determination as to whether or not you have venous insufficiency. But the only way to definitively diagnose if you do have venous insufficiency and to what extent is to get an ultrasound performed on the legs. And what we're looking at specifically are the veins in your legs. We do a vein mapping procedure where we're actually looking at the diameter of the vessel to see how stretched out they've become and how much of that backwards flow is there. It's called venous reflux, and that's what diagnoses the failure of those valves, which leads to the venous insufficiency problem. Once we've got your diagnosis accurately made and we know which vessels need to be treated, there are multiple treatment options depending upon what the vein size is and which veins we're talking about. The most common and the first procedure that we typically address is the deeper veins in your system that are leading out to all the super veins in the leg skin and whatnot. So those deeper veins are treated by an endovenous procedure where a catheter is passed through the vein on the inside. This is painless. The only thing that you'll experience is a small numbing at the skin level where a small incision is made in order to get access into the vein. Once the catheter is appropriately placed in the vein to be destroyed, we have two different methods that we can apply. One uses heat, which will cauterize the vessel and burn it close so that blood flow can no longer occur through that vessel. The second method, which is a newer procedure, which also works just as well, is a gluing procedure where glue is administered on the inside of the vein, and by holding pressure to the outside, the vein walls are opposed and are glued together. This again effectively stops the blood flowing through that vessel so that the venous reflux will be destroyed. Once these veins that are deeper in the body are taken care of, then we examine some of the varicose veins that are also focally symptomatic and problematic and are at high risk for having blood clots or causing focal symptoms. These are addressed by a chemical injection called sclerotherapy. Sclerotherapy is a detergent that is injected into the vein that will kill the vein from the inside. Over time, your body will simply destroy the vein, chew it up, and get rid of it over time. These are the most effective treatment methods today that work very, very well at getting your venous insufficiency under control. On the day of your procedure, we're going to ask that you drink a lot of water, avoid caffeine, do not wear your compression stockings for about 7 days prior to your procedure, and stay as active as possible on the day prior to your procedure so that those leg veins have become as swollen as possible. This makes it easier for us to access them during the procedure. Once you arrive at our office, you'll be greeted with a friendly smile and a handshake. Once we're prepared, we will bring you back to the procedure room where your leg will be prepared sterilely, draped out, and once we get you comfortable in the seat, we will then start the procedure by first injecting a little bit of numbing medicine in the skin near the site where we tend to access the vein. Once the procedure is over, your leg will be wrapped in a compression dressing and you'll be allowed to go home. Once you're at home, we expect you to take it easy that evening, keep your feet elevated, walk around every hour for a little bit. We want to keep the circulation going. This helps to avoid blood clots as well. You may experience a little bit of achiness, which will be controlled easily with either ibuprofen or Tylenol, whichever suits you best. Most people don't require anything. The day after your procedure, life returns to normal. You can return to work. You'll remove the compression dressing and put on a compression stocking after a nice cool shower. After that, we will follow you up within 3 days with a follow-up ultrasound, making sure that the procedure that we performed worked appropriately, and making sure that there are no blood clots or other complications. After that, we will routinely see you and follow up for reevaluations and continue on with your care.